I think when we talk of incentives, I mean, quite a lot has been written about and a great deal of evidence on using incentives to nudge some behaviors and towards encouraging some positive behaviors like better utilization of health facilities and things like that. So I'd like to add one point is like, for example, again, I was saying that our experience, collective experience for the last considerable period of time, and we were in India. We have tried the JSY and the JSSK, and I mean the different maternity assistance programs, various forms of programs which we have, and we have been kind of experimenting with different models that whether to incentivize one specific behavior like institutional delivery or like I'm bad in remembering the abbreviations, but a recent program which has been tried in Odisha and then elsewhere is a larger package, and then I mean allowing the cash things to be given at different points, like for antenatal care, you complete, then you get something, and then delivery, and then postnatal care, immunization. So, I mean, the kind of a staggered approach. So, the thing here is perhaps again, it does work. There are incremental benefits. Our work has shown that probably, which is a bit surprising, is well, the incentives does work in general, even if they are modest benefits. But then it's not automatic that it's always very equitable. So which means that at some point there are some kind of leakages, or like the better off, more educated among the target group, even where the program is targeted, tends to benefit more. So which again brings back to the question I told earlier of governance. And here, like kind of using the existing political and administrative structures in implementing. Like, for example, we are interested in doing some work in correlating the performance of these incentive programs in panchayats, which has a woman panchayat member, for example. So whether Professor Chattopadhyay was telling this earlier, that they have seen that there is more benefits for these programs where they have, and whether that translates to the equitable issues as well is an important area. So yes, incentives for demand side does work, and but it needs a little bit more to ensure that it's equitable. A little bit of a minute of addition to it is supply side incentives, because I think perhaps less talked about, and there were some mentions again during the last 2 days, that how to use these different incentives to improve supply side performances. It's pretty much comparatively rather new in the health system context of studying the role of different incentives in driving desirable behavior. It does not only involve peripheral health worker like the ASHA or the ANM, it also involves using different forms of incentives to influence behavior further down up. Like a very good example is recently the PMJY has come up with a plan of using different hospital accreditation systems with different payment bands to induce private hospitals to get as gold, premium, or bronze categories, so that they can get some additional premium, as also get more patients. And so I mean, what I'm trying to say here is like even supply side incentives through well set arrangements, contracts within the public system, within peripheral workers, probably the fruits are a bit low hanging, where you can try and test different forms of, and remember, it's not always just monetary incentives. My bit of example with, experience with health workers in India tells that a lot of non-monetary incentives, an SMS message from the district magistrate to an ASHA worker congratulating her for the fantastic work does matter. So, I mean, so things like that, a lot of non-monetary incentives combined with different forms of incentives, such as like better working conditions, a form of transport allowance, and things like that actually help. So, the moral of the story with my bit of last 10 years of work here is like a combination of demand side as well as supply side incentives with a proper backing structure, combining various forms of incentives with definitely, as I was mentioning, like good political will and administration, I think can make a big difference, incremental change in most of the women's health outcomes we are talking about.